And welcome to today's edition of the Lance Roberts Show podcast. I'm your host, Lance Roberts, and really excited to have Daniel LeCalle back on our show today, of course. He's got a new book coming out, Freedom or Equality, which you'll be able to get at your local Amazon best retailer, wherever you get your books from. I've actually read the book. Daniel was kind enough to send me a copy of the book. I read through it. It's absolutely a phenomenal read. And kudos to you. It was very entertaining, as well as being very educational and informative. I actually learned a few things while I was reading the book. So I really appreciate that very much. Freedom or Equality is the name of the book, so make sure that you do get yourself a copy. Daniel, when does that hit the bookstores?
Oh, the book will be out in March 2020. It's already on pre-sale, as you said. But it will be out in all retailers in March of 2020.
It's not that far away. This is already October. It sounds like March of 2020. It sounds like it's way out there.
Exactly.
So let's talk a little bit about this, because I wanted to have a conversation with you today to talk a little bit about capitalism, because capitalism is under attack. And if you take a look at some of the candidates that are running for president, Elizabeth Warren, Bernie Sanders, Bernie Sanders, of course, really very socialist in nature, has a lot of these views. But it's also interesting because while you and I are going to talk about capitalism, capitalism is already dead. The reason is that the group of youth that is now coming up out of college, they've been indoctrinated in these ideas of socialistic tendencies, and they're our next leaders. They're the ones be making the laws that whether or not we, provide free health care or these other issues. But I did want to talk a bit today about your book, because you bring up a great point. Is it really equality that we want in a system, or is it equal opportunity?
Absolutely. I think that the reason why I wrote the book was precisely because there's a big mistake that is being used by the socialist movements in order to try to put into people's minds that socialism is good, that equality means egalitarianism, and it's not. Equality of opportunity is something that we all agree with, and I don't think that anybody that has ever visited the United States or anybody that immigrates to the United States does for any other reason than for the fact that there is equality of opportunity, that there is equal opportunity, that you can achieve your best in the United States, for example, as in many other countries, because somebody that does not come from a privileged background can achieve that person's goals and their absolute best. So I think that equality of opportunity is something that we all agree with. But equality of outcome is extremely dangerous. And the reason why equality of outcome is extremely dangerous and is being sold as a magic idea is because most of the people that are defending these socialist measures come already from a privileged background. Mm-hmm. You take for granted the things that you already have, like access to cheap goods and services, like freedom of speech, like all the things that they're actually enjoying, whilst at the same time demonstrating or criticizing it from capitalism. They take for granted those, and they don't understand that egalitarianism always leads to poverty and totalitarianism.
So it's an interesting concept that you bring up, because you're absolutely right. If you take a look at socialist countries, communistic countries, they make it sound like that in a socialist environment, like a socialist backdrop, that everybody is equal, everybody is living well. Wealth is spread across the country, and everybody is living a better standard of living. But and you erode by having this equality of wealth, or this wealth sharing prospect, that you get rid of the wealth gap between the rich and the poor. However, if you look at communist countries, look at socialistic countries, the wealth gap there is bigger than it is in any other type of economy, particularly in the United States, because you have those that are the political elites, and then you have everybody else, which is poor.
Yeah, absolutely. Socialist economies and communist economies do not get rid of inequalities. What they do is basically direct those inequalities to the politically privileged. So if you look at, for example, Cuba or Venezuela, there are very few people in the world, including in the United States, that are as phenomenally rich as the dictator family in Cuba, or like the Maduro family in Venezuela, etc., etc. Not just those, no?
Right.
Very few people are able to achieve that level of wealth without working, and in any other country in the world. So inequality is actually monstrous. And if you remember the Soviet Union, in the Soviet Union, the level of wealth accumulation of the bureaucrats that were close to the Politburo was phenomenal, not just by Soviet standards relative to the rest of the population, but compared to the rest of the Western world. Mm-hmm. So that is an important factor. And the reason why these ideas are being crept into people's minds start from a false premise, which is that, of course, we don't agree with the Cuban or the Venezuelan system. We are thinking of the Nordic countries, no? The Nordic countries are this sort of mirage that everybody that has never visited those countries seems to believe in. The Nordic countries have nothing to do with socialism and everything to do with equality of opportunity, because the first and most important pillar of the way in which their society is constructed is individual freedom. These are countries in which the level of bureaucratic control of the economy is very limited, in which they're always at the top in, for example, the economic freedom indices, etc. So they place individual opportunity and individual striving for prosperity as a key part of a system that then all together and individually decide to use to redistribute a part of it, but they're not based on redistribution in any shape or form. One of the things that I put in the book is that if you look at wealth inequality, as you very well mentioned before, not just income, wealth inequality, these countries are actually enormously unequal.
Right. And I want to specifically, I want to target, and this is I was going to ask you this question anyway, because I want to kind of dig into that just a little bit here, because that's one of the arguments that's most often presented by people that are kind of supporting these ideas of socialism. They go, yeah, but, capitalism is clearly broken in the United States. We need a social democracy like they have in Denmark. Denmark and Norway have been held up as examples of how effective a social democracy can be. But this is exactly the point you're making here. These countries are also vastly different than the makeup of the United States.
Completely. Think about this, for example. When you talk with left-wing leaning economists, they always tell you, and maybe rightly so, that the example of countries like Estonia, which is not valid for the United States, because Estonia is a very small country, and that model cannot be translated to a country as vast and different as the United States is. Interesting, because at the same time, they look at countries that are smaller than New York and say that those are the examples that have to be transferred to the rest of America. And I think that ultimately all of this comes down to a single thing, which is whitewashing interventionism. Because ultimately, if you agree that that some of the parts of the system in the United States are broken, if you think about this and if you really understand what's going on, the parts of the system that are broken are precisely the ones that are more intervened by the government. Mm-hmm. You see, Cronyism doesn't exist if it's not because of government intervention. And one of the things that prevents some other economies from having cronyism is by having a very limited level of power at government. It is not the same to have a large level of public spending, for example, like in some of the Nordic countries, than to have a large government. And this is where the Bernie Sanders and the Ocasio-Cortezes of the world blur the argument. No, they say, we want universal healthcare, and they include, as if it was a given, that it has to be a single payer universal healthcare run by government. It's a big difference, no?
Right.
Same thing with so many other things, that they create a myth that does not exist about that example. And more importantly, the only reason why socialists have shifted from the example of Cuba or the Soviet Union or Venezuela, etc., that they defended themselves. Bernie Sanders, you can check some articles in which he was saying a few years ago that the American dream was actually present in Venezuela and in Argentina more than in the United States, which obviously he has now forgotten. No, so and bless his heart, I hope he gets better.
Yes.
But the point that they is that because of the absolutely atrocious track record of socialist economies, they have gone and looked as an example at economies that have nothing to do with socialism. And I recommend anyone that's interested to watch a video of the Prime Minister of Finland and the Prime Minister of Denmark saying that, that those are free market economies. There's absolutely free market economies, no?
We're talking with Daniel LeCalle right now, author of the new book that's coming out, Freedom or Equality. And I encourage you, the book will be out in March of 2020. It's pre-selling now, and I encourage you to get it. It's a fantastic read. It's what we're talking about today. Daniel, I'd like to pull this conversation back to the United States here for a second, because you brought up something very interesting, and this is something that I've been talking about for a while. The healthcare system has problems, right? And under the Obama administration, they decided to reform 1/6 of the economy all at one time. It turned out to be a disaster. Rather than fixing what was broken in healthcare, medical billing, tort reform, these type of things, trying to do a takeover of the healthcare system led to unintended consequences and bad outcomes. Capitalism in America is not broken. It's not this evil thing that is made out to be. There's Mike Jones, the guy down the street that opens up a car repair shop and earns a living for him and his family, and he participates in the capitalist economy by providing a service for a fee, of which he controls that outcome. He chooses that pathway. Participates in capitalism, has the opportunity to do that. There's no restrictions to opening a business in the United States and becoming self-employed and participating in the capitalist system. What people are upset about is the one area that's broken in capitalism, which is the deformity of capitalism by Wall Street through these corporate share buybacks that have, and really, I shouldn't say just buybacks, but it's been the compensation of executives, but with stock share ownership, that has distorted the wealth gap in this country to a great degree. A lot of the people at the top of these corporate ladders, whether it's a corporation or whether it's these unicorn IPOs that are coming out, hundreds of millions of dollars in wealth, and really haven't contributed that much to the capitalistic system as a whole in terms of the actual output. So, there's a big gap between the pay of employees and these CEOs, some of the largest on record. And that's what people are angry about. So do we need to reform capitalism and turn socialistic, or do we just need to reform Wall Street?
I would absolutely agree with that. But we also need to reform the monetary system, because what you just perfectly described is a consequence of something that is much more complex and much less easy to solve, which is that the solution to the different crises that we have seen in the last years has been fundamentally to cut rates and increase money supply. Mm-hmm. Obviously, money creation is never neutral. And this is what leads now to the idea that instead of printing money for bankers on Wall Street, we're going to print money for the people, is what Ms. Ocasio-Cortez tells us, no?
Yes.
So what she's basically telling you is that something that has been incredibly negative for the economy is going to be even more incredibly negative, as the examples of Argentina, Venezuela, and so many other countries have proven. No, mm-hmm. So the point is that we need to really teach people and make people understand that the solution to the imbalances of the economy don't come from printing artificially more money. Because either way, be it the way that it is right now in the points that you just mentioned, which are absolutely correct, or the other way, which is generating hyperinflation and creating poverty for everybody and very high wealth for the selected politically connected, it is showing the reality that, that money creation is not neutral and that it's impoverishing. It ends up impoverishing the society and creating larger problems. So I think that we need to fix the way in which Wall Street remunerates, and there is where the book, Freedom or Equality, touches upon important factors, I believe, in terms of corporate responsibility and in terms of the redesign of how corporations should address the wealth of nations and the prosperity, not just of their stakeholders and their employees, but the society as a whole.
But so here's the interesting thing, because you brought up just a moment ago that when we talk about cronyism, which clearly exists in the government today, and this has become a bigger problem really just in the last 10 years, as much as it's been the last 20 years. But we talk about the need to reform the financial system to a degree. And again, after the financial crisis, the bailing out of the banks and corporations and, ultra low interest rates and monetary policy, all this has led to this growth of cronyism within government. Even the tax cuts that were passed recently by President Trump was targeted at corporations rather than targeting tax cuts to individuals who needed them the most. We have an environment where the actual legislation and policy that's being generated by government is maybe not primarily, but largely controlled by influence and contributions and donations from Wall Street. You have such an incestuous relationship. How do you ever fix the problem without, doing something drastic like moving to socialism?
Well, exactly. I think that is part of the solution, and that is why capitalism, as a system that is not based on a dogma and that adapts to reality, ends up finding the ways to address those issues. And I think that it's starting to happen. I think that on one side, for example, the healthcare problem in the United States, I think that it's becoming more and more evident, and the hundreds of followers that come to me and talk to me about the situation, they can clearly understand that something that is very simple, but we don't say enough, is that monopolies and price inflation cannot happen well above and beyond what society would accept unless government promotes it. You cannot have a monopoly. You cannot have, like in a few states in the United States, you cannot have two healthcare providers unless the government forces it to happen. Actually, there's a couple of states in which you have only one healthcare provider. Right. That is because the government makes it happen. No. So how do you change that? You change that precisely by not aiming at the wrong solution. You change that by all this great level of freedom that we have and that we can express, targeted to improve the things that are working and that have some flaws. Absolutely they do. But don't try to change everything into something that has proven over and over and over again, like socialism, that it's a failure. It was Thomas Sowell that used to say that socialism has such a massive track record of failure that only an intellectual could ignore it. And it is, and that's the thing, is that you go to college and many of my peers, I'm a professor at a university, many of my peers are basically prolonging adolescence to tell people that their problems are because of the system instead of reality checks that we have lived all the time. So you fix healthcare not by making the mistakes And that's why I do the comparison when I talk about healthcare of the huge problem that we're living in the Eurozone countries, in which not only that the healthcare is fully funded via more deficits, but more importantly, that healthcare is that you need to have both a private insurance and you are forced to pay for the public healthcare in any case. But the point that I'm trying to make is that the challenges that the United States has cannot be solved by destroying the good things that the United States has. You see what I mean?
Yep.
The healthcare system is not going to be sorted out by making the highest quality, best doctors, best treatments available in the world that the United States has become bad. No.
Right.
In case of corporations, it's the same. You have some of the most innovative, some of the most exciting companies in the world that are creating huge differences and fantastic change for the world, and you will not have that by destroying the entire system, but by just simply tweaking a few of the issues that you very well mentioned, like, for example, the unnecessary use of liquidity to buy back shares, or by addressing, for example, you were mentioning tax cuts that could be extremely beneficial and that sometimes are miscalculated, not necessarily badly presented, but miscalculated.
I want to talk a little bit about healthcare here real quick, because you brought this up, and this is one of the big challenges right now. I think this is one of the big focal points, of course, by the Democrats that are running for the election, is trying to figure out how to give people free healthcare. And this was one of the things that was really kind of front and center of the Obama administration, was the Affordable Care Act. It was supposed to allow for the government to provide a cheaper source of insurance, because we had 20 million people that were not covered by any type of health care. They were our poor, downtrodden individuals of the economy, and we needed to cover them. And so we passed this Affordable Care Act, which lifted the cost on all Americans, because we included the sick and the unhealthy into the insurance pools, raised the cost on everyone. And still today, that 20 or 30 million people that were not covered previously are still uncovered because they can't afford the insurance still. So a lot of people say, well, we need a healthcare system like Europe. We need a healthcare system like Australia. And it's interesting, as Australia is a great example of this. They have a public and a private healthcare system. And if you go to the public healthcare system, the hospitals are overcrowded. The quality of service is not great. Yes, it's cheaper, but you pay for it through a much higher tax rate. And if you have money, you go to a private health system where you get better quality care.
Yeah, I think that what is misleading about the debate in the United States every time that I go there is that somehow people have been convinced that you can have a system that pays for everything to everyone and that is going to be cheaper. That is ridiculous. It is ridiculous, and it is not cheaper.
Right.
And the reason why healthcare costs in the United States are higher, as I explain in the book, there are many reasons, but one important reason, hugely important reason, that makes a big difference relative to others is litigation costs. Mm-hmm. And this, my friend, is not going to change, because it's a system. The system of litigation in the United States has tremendous benefits for everybody, thanks to the way it is. In fact, thanks to the fact that people can decide at some point to sue somebody else and be adequately compensated for the damage.
Yep.
So that doesn't happen in the Eurozone or in any of those countries. You have a problem in the public healthcare. You go to court. You don't get compensated, my friend. Yeah, and definitely you don't get compensated millions, not even thousands of anything.
Right.
Yeah? So this is an important factor that people need to understand. The other important factor that they need to understand is that there is none of the countries that they use as a comparison that has 100% public system. All of them are systems in which you have to pay for the public system. It goes out of your salary every month, whether you want it or not. And on top of it, if you're if you have a little bit of not of income, I would say low to mid income classes, you on top of that you pay for private insurance. This is what many in the debate in the United States, it is presented as something that is either 100% public or 100% private. First, in the United States, you already have Social Security, Medicare, Medicaid, all those things. So it's not dissimilar. It is only significantly more expensive because of numerous things that differentiate the United States from the rest of the world. One of them, let's be fairly honest, is eating habits. And
obesity. The United States is number one in obesity. Let's be honest about this.
Absolutely. My children, we love America. I mean, I cannot be more favorable, but my children, every time we go to the United States, they understand, that the portions, everything is. So there is a part of the cost that comes from habits. That is a fact. Second, litigation costs. Third is that in many cases, the healthcare system in the United States has all the negatives of a public system and all the negatives of that can come from a private system. No?
Right.
So in the book, what I say is, look, first, you will not be able to save money on a fully government owned system, because the sources of cost increases in the United States don't come from to other economies. There's a third factor, is that and this will have to be addressed at some point. The United States citizens are paying for the research and development of medicines of the rest of the world. Mm-hmm. And it's a bit like what happens with the military, is that you have a monster military budget because in many cases you are compensated for the lack of military budget of other countries. In medicine, it's pretty much the same. In the price of many medicines in the United States is incorporating the cost of the research and development that other countries in the world are not paying, simply because it is not passed through to consumers. So all those factors are important, but the solution to the U.S. system is not to destroy the good things about the U.S. system. Mm-hmm. If you have some money in Europe and you have a serious health problem, and I have experiences in the family, you go to the United States.
Yes.
You go to the United States, you pay with your private insurance, and you get 80% of the cost, and you're willing to pay for 20% mm-hmm. of the full cost, which is astronomical, because it's better. And there's higher quality. And I'm not saying that it's bad quality in other countries. I'm just saying that you cannot take for granted how good the U.S. healthcare system is in quality and in medical research and development. Yeah. But the point is, how do you address the cost and how do you address the insurance premiums? You can only address that through higher competition. And the problem in the United States is that you don't have higher competition. Mm-hmm. You have a system that is incredibly intervened, even at the level of Food and Drug Administration approval of drugs and the substitutes that have a cheaper cost, as we have seen with insulin. All of those things could be solved by improving competition and improving the system, and at the same time you could gradually go to a universal system that does not need to be government owned and one and single payer. Yep. This is the part that infuriates me about the debate with some of the Democrats, is that they talk about the universal system. I don't have a problem with that. That is a community decision. But then they include, as if it was a given, that it has to be government run and single payer. There is absolutely no evidence in any country in the world that makes it better or cheaper.
Well, I think sorry to interrupt here, Daniel, but this is a great point that you're bringing up, something we argue often here, which is that anytime that you insert anything between the patient and the doctor, you're going to increase cost. If you put an insurance
Absolutely.
company between the patient and the doctor, the costs go up because the insurance company wants to make their money. If you put the government in between the insurance company, the doctor, and the patient and everybody else, costs are going to go up again. We have a great example here in Oklahoma. We've actually interviewed the doctor on our show several times. For $50 a month, you buy a membership to his clinic. You show up, an EKG costs 30 cents. An aspirin costs a nickel. These are basically what's passed on, to you as an individual, but he does the basic body checks, right? He does the basic maintenance. His solution, and I can agree with this, is that we should sell health insurance like we sell car insurance. You buy catastrophic car insurance if you have a wreck, but you take care of the maintenance. And if we did that, costs would come down. You get government out of the middle of it. You restrict the role of insurance companies to catastrophic coverage, return responsibility back to the patient, costs come down, and now the patient's responsible for eating better, exercising, take care of themselves, and they take care of their routine maintenance rather than running to the hospital every time they get the sniffles because it's only a $25 copay. Somebody's got to pay for that.
Absolutely right. I always say this about the US insurance system. It's exactly as if you go to the dealer down the street, get yourself a second-hand Cadillac, and they tell you that you have to have a Ferrari Testarossa insurance. And you're like, what? No? Makes absolutely no sense. So what do you decide to do? Not have insurance.
Right.
And then that is a critical point that you mentioned before. And the failure of the Affordable Care Act comes precisely from that. At some point, whoever is in government or whoever is talking about healthcare solutions for the United States needs to understand that the United States citizen does not think in the same way as the French or the Belgian. There will be millions of people that will decide not to have insurance. Decide, not just because of cost. That is something that is addressed exactly the way that you mentioned, by having ad hoc and basic levels of treatment and covered in different stages, pretty much the same as what in the Eurozone or in Japan or in Australia or in the UK you have in private insurance. You go to, you can have private insurance that is as cheap as, the equivalent of $15 a month for all your family. And then you can add to that different layers, etc., within a system in which there is that level of competition. But again, in the debate of healthcare, there is something that politicians are not addressing in the United States, is that regardless of that, the way that the United States, you have to know history, the way that the United States has been and continues to be, is that there will be millions of people that will decide not to have insurance. I had colleagues at Citadel, a top hedge fund in the world with monster salaries, that personally decided not to have. I'm still in awe when I remember that. Personally decided not to have insurance. Why would I?
Right.
Well, hey, your choice, but don't make me pay for it afterwards if you have a problem. See what I mean?
Yep, absolutely.
So, and the other problem is you cannot address the U.S. healthcare problem starting today for the future, looking at the Eurozone or Japan or Australia today, looking at the past. Because the aging of the population, the costs embedded in the system, and the already existing, for example, the Eurozone has already prepayment in medicine. The Eurozone already has double payment, public and private healthcare. The Eurozone already has a problem in which healthcare and education are already being paid via massive deficits. So, hey, you need to address aging of the population and personal choice and litigation costs to understand the solutions, the real solutions to a great system that can be improved, like the United States is.
Coming back to the original focus of the conversation, which is freedom or equality? And, what's more important here? Because, when you listen to the politicians, they're talking about wealth equality. There was an interesting tweet out from the Wall Street Journal earlier this week. I actually quoted it in an article I wrote. The author from Wall Street Journal says, capitalism in China has lifted millions out of poverty. The dark side is wealth inequality. Well, if you dissect that and think about that for just a moment, he's saying that the introduction of capitalism lifted millions out of poverty. That's great, right? We've lifted millions out of poverty. But the dark side is wealth inequality. Yes, those that took advantage of the introduction of capitalism created an opportunity. They took advantage of an opportunity that they had, and it created a wealth inequality between those that took advantage of that opportunity versus those that didn't. It also tells you that in the communist system, before the introduction of capitalism, everybody was poor.
Mm. So you see, let's start by why. Let's start. Why would you be worried about inequality when the Gini index tells you that there is maximum equality in 60% of the population, 70% of the population? Because this is a key factor. Is the Gini index that measures income inequality shows that the countries in which everybody seems to be so concerned about inequality have a level of equality that is absolutely amazing and great, no?
Right.
And the reality is shown in any state in the United States in which somebody that is very poor has an access to goods and services that is unequal compared to any time in history. It is true that there are people that are vastly richer, but it's also true that you cannot make people more equal any other way than down. The governments can only equalize down. You cannot equalize up. You cannot make people go out and say, hey, we're going to make everybody Warren Buffett. No, you can't do that.
Right.
The only thing that you can do is bring Warren Buffett down, not giving ideas to anybody. But you see what I mean?
Yes.
Is that the idea that governments are going to equalize up makes no sense and is based on historical inexistence. And in China, think about this. The dark side, said the article, is income inequality in China. I challenge the writer of the article to come with me to any of the trips that I go to China and ask around how they see themselves. Mm-hmm. Do you think that to ask people one by one in the streets, what are you worried about? Income inequality or the fact that now you can afford a house?
Correct.
And it's because it's a false narrative.
Right.
It is a false narrative that in India, that in China, that in Africa. I lived Africa in the early 80s, late 80s, early 90s, when it was devastated by civil wars and coup d'etats all over the place. There's absolutely no way anybody is going to tell you that they're worried about inequality. So the point is, the problem is because nobody, and think about it, everybody here might be a football or a baseball fan or a music fan. I don't think anybody disagrees on the fact that if Kanye West has millions, it's because he deserves it, no? And that if there's some, I don't know, horrible rapper out there that doesn't sell a record, he doesn't deserve it. So So think about it from that perspective. What the egalitarians are trying to do is to make those two, regardless of merit, be as equal as possible. Well, that absolutely makes no sense. But what makes sense in the debate is, coming back to the earliest part of our conversation, is that a lot of people perceive that there's a big part of the wealth creation that doesn't come from merit. Nobody has a problem with, I don't know, Chris Rock or Denzel Washington or I don't know, you name it. Anybody that's achieved millions because they deserve it, to have that. I think that there's a perception that precisely because of the rise of cronyism and the rise of government intervention in the money supply growth, that there are people that are accumulating a level of wealth that is not derived from merit or from prosperity. And that is where we can do things by changing small things. But you cannot achieve that level of improvement by bringing the whole system down and then forgetting that what you're taking for granted, which is that we live in an era of high prosperity, is not something that you should take for granted.
Freedom or equality? That's really the question, and that's also the name of the book. And I encourage you to get it. Daniel LeCalle, the author of that, economist and professor who's never invited to any of their professor parties. But I do encourage you to get the book. It will be out very soon, March of 2020. The book will be out, but you can pre-order it now at Amazon. And of course, we'll make sure and get you all that information as well on this video. Daniel, thank you so much for your time today. It was an awesome conversation. The book is an excellent read, and it's something that I wish I could get more of our youth to actually read the book to understand, because there's so many, and we could spend, hours talking about this subject, but there's so many things our youth really don't understand because they didn't grow up with the benefits of capitalism. They've been inundated with, the media and a lot of these false narratives that are out there, and they simply just don't know better. And they don't know the questions to ask because they don't really understand and they don't study history. And it's an unfortunate outcome for them that they are walking themselves into a lower quality health and wealth future than what they could have if they benefited from the benefits of capitalism.
Absolutely. Absolutely. I think that the great thing about capitalism is that you have the ability and the freedom to criticize the things that inevitably out of any system do not work. The difference with socialism is that in socialism you go straight to jail. Here you can improve it, and you can make the system better for everybody. Because at the end of the day, those that say that they're against capitalism, what they're really saying is that what they want is real capitalism, because they understand the benefits of those things.
Exactly. Daniel, thank you so much for your time today. We so much appreciate it. We'll have this podcast out on our website, realinvestmentadvice.com. And of course, as always, all of our podcasts are interviews with all of our great guests like Daniel, always on our website. Of course, if you have any questions at all, you can email me and I can forward it to Daniel if you have a question directly for him. Happy to do it. realinvestmentadvice.com. We'll see you next time on the next edition of the Real Investment Show podcast. I'm your host, Lance Roberts.